start off with today's show, we have Deven Patel here, CEO and President of GIOSTAR. He's leading the innovation in the stem cell space. I would like you to just give a quick introduction of yourself.
Well, again, thank you for the introduction. I'm going to repeat the same introduction. I'm a founding member of Global Institute of Stem Cell Therapy and Research, known as GIOSTAR. We're based in San Diego, California, and we're in the business of stem cell research for more than 2 decades. And the whole purpose of this science or this treatment modality is to get to the root cause of the disease and getting rid of your disease from the root cause without surgery, without downtime, and without any side effects. So it's the most natural way of using your own cell to getting rid of your diseases from the root cause without surgery, without downtime, and without any side effects. To make it
Right. Thank you so much, Devin, for sharing that and just introducing yourself. Today, we're going to be talking about how AI is transforming the healthcare industry. And we have a few topics that we want to quickly brush over and go over. So the first topic for tonight is the role of AI and technology in enhancing patient experiences and outcome. So in your opinion, in your practice, how do you see AI and technology enhancing the patient experiences and outcomes?
Well, this is a great question because we've been working with you in creating avatars, chatbots, and many other algorithms for our practices and our science, so we can use your services and AI in a way where, let's say, for example, simplest form of chat, AI is a chatbots. And chatbots are much easier for a patient to communicate because it saves time and create a tremendous convenience for a patient to get it, for us to answer the basic queries and questions. And chatbots are wonderful taking care of that. So saves time, great convenience for patients, and enhances the quality care.
Right. And how do you see AI being able to personalize healthcare while still maintaining a human connection?
That is the hardest question you have asked, but it's the most important question you have asked. And in healthcare, no matter how much technology you bring, the human-to-human connection is the key to the healing. And that's what we always discuss at our facilities, that whether chatbot or no chatbot, that first call that you receive first time from the patient and how you greet them, that hello, has to be so healing that their healing journey starts with that hello. After that, yes, you use your technology such to enhance their experience or make it better or more efficient. And for example, predictive analytics will identify the predisposition of certain disease of the patients so that you can create much more preventive treatment modalities for better outcome. All that jargon is no good if you don't have human-to-human connection. And that's why in our facilities, the human-to-human connection at every level, the way our driver opens the door or close the door and receive them with that very healing and caring smile, genuine smile, that is so important. You, in this business, especially in healthcare, you cannot replace the human touch, or any business, I would say, for that reason. You can use AI to enhance your product, services, operations, efficiencies, all that. But human touch can never be replaced.
Absolutely. Actually, in one of our previous podcasts, we just recently heard about, where AI is playing the maximum role and in actually improving the patient outcomes and experiences. And that is, it's not competing with people. It's competing with the absence of people. When there is no care being received, that is where AI comes in, and that's able to deliver care in places and to people who don't have access to it.
That's what we were trying to develop with you. Remember, we were talking about remote patient monitoring using the AI to help basically track their vital signs. I'm looking at some of my notes so I don't forget and cover these. So that AI can track the vital signs and detect the anomalies, and that will lead to the timely care. So all
Right.
that is excellent use of AI where there is no access, as you said, it's the absence of human touch or the human intelligence where the AI
Right.
can take that place, not replacing the human at all. And like, for example, AI algorithms will analyze the medical images, right? And
Yeah.
adding and aiding in a faster and more accurate diagnosis. And when you have that, when you have human experience of, let's say 10, 20, 30 years with that AI experience of, detecting millions of images like that, which human can never do that. And that will only aid that particular expert or a doctor or a medical practitioner to come up with the better diagnosis so that
Right.
patient get the much better care. So again, it is all about enhancing the human experience both way on the provider side and the
Provided.
receiver
And
side and the receiver side. And another thing that I wrote down here, the personalized treatment plans are based on AI analysis for patients' data, and that will lead to better outcome and satisfaction. The personalized treatment plan, if it's analyzed with the AI, it much better. And it
right.
gives it better satisfaction. And also people nowadays, it's not a fashion. How do I say it? It's more of a, I think AI is a part of our lives already, whether we like it or not. And AI has been
Right.
with us for a long time. We just gave this name nowadays, AI, artificial intelligence, but it's been with us for so many decades. But now the exponential growth with the technology and the better chips and better enhanced data that it is growing not even exponentially. There's another word we have to look for. It is so fast that we can't even keep up with it.
Right, right, right. So another thing, I mean, being a global entrepreneur with presence across the world, I wanted to understand, obviously, expectations change from country to country, people to people as cultures differ. So, uh, how do you see technology help bridge that gap? And like, how do you see people like, engaging from different countries with AI?
My experience is very diverse because I travel around the globe for last 15 plus years, maybe 6 months a year, or even sometimes more, constantly
Right,
meeting with a different type of people, different type of thought leaders, different type of political leaders, different type of health leaders, different type of technology leaders, all kind of people I have worked with and meeting with and discussing things. And you cannot pinpoint that every culture is different. Their mannerism is different. Their way of doing is different. Their way of thinking is different. Their way of eating habits is different. All this has to take into account for that particular AI tool to address that particular culture or the country or the people, uh, because that again, that's AI is all about customization. So I have here more notes to share with you that how we make digital innovations more accessible and efficient, and that absolutely very relative term. And another best part is a telemedicine platform, right? It does the remote
right,
consultations, expand access to the care for the unserved and underserved areas. That's another way of doing it.
right.
How you customize it depend on that particular people, their language, because AI is so good at languages that you don't have to worry about that barrier of language. I can be speaking different language, you will be speaking one language, but we will have the same conversation with the same speed without any interruption. So that's what I like about it. And then electronic health records streamline the data management, right? And
Right.
reducing the administrative burden all the time that kind of always affecting the efficiency of managing all these paper files and thousands of files around the hospitals. all that is gone in matter of seconds, and it's all accessible at a matter of seconds, or even less than a second. I think second is too long nowadays with AI.
Right,
And
right.
also like mobile health app, I wrote it down here, that those are the tools that help people to manage their health much better, right?
Right.
Because it's in your hand. You don't have to look for a doctor right away. And also it enhances the engagement, because now you have a very educated patient, not just somebody who doesn't even know what is the higher and lower side of a blood pressure, and like, well, okay, 110 versus 1089, like, okay, what does that mean to you? But nowadays these kind of tools make people much aware and much educated about their basic health. I'm not even talking about complexities, but at the same time, very simple thing like online appointment. I love that. I hated originally, like, I need to talk to a person. But now these calendars and all these things is so easy. Even I scheduled my, podcast with you on your calendar, and it was so easy. I picked my convenient time that you are available and I'm available, and we don't have to go back and forth. And I'm not available or you are available. All these complexities, and originally I didn't like it, but now I love this. It is so easy for me. I don't have to call. I pick my time, which is convenient, and I go with it. Or data analytics in healthcare, especially data analytics, uh, especially in disparities, a lot of disparities, right? So this will help. Uh, uh, Better data analytics will help look at the targeted interventions and provide much better treatment plan and the outcome at the same time. So all these complex information analyzed in a way where doctors or healthcare providers can come up with a much better conclusion or diagnosis. Because I was reading somewhere that a human experience with the 25 years of healthcare provider and AI, and the human experience of 25 years are good at about 60-70% time. And when they aided with the AI, I think it was more than 90% accuracy.
Absolutely.
Means, again, this is complementary. This is not AI taking over human experience. It is actually enhancing the human experience in a way that you have a much better diagnosis for your, or much accurate diagnosis for your patients. So you're not putting into the wrong medicine. In America, we have seen many misdiagnoses and a prescription that led to many life-threatening situations.
So the decision support is also a big thing, and we briefly spoke about preventive health, we spoke about population health, and thank you so much for sharing all of these insights. And definitely, I mean, at a scale, AI is actually helping improve healthcare, make it accessible, improve outcomes at large scale. So that's great to hear your views on that. Finally, we would just want to understand, I mean, like we don't have a word to put on how fast AI is growing and it's evolving. And even today, at its current state, there are hundreds of applications, if not thousands, that we're seeing come up, which are helping physicians, helping insurance companies, helping the whole health ecosystem, keeping patients at the center of it. So, what do you see as the future of AI and the future of these technologies uh, in health systems?
So I'll go with the most simplest to most complex. Okay.
Sure.
The simplest one is like wearable device, right? Which will continuously monitor patient health and provide the real-time insight for a personalized care. Simple, all these wearables, my heart rate and how many steps I walked and what is all that basics. That's the simplest part of the AI.
Yeah.
Again, then you take it to the complex side of it, where you take all the genomic data integrated with AI, will predict and prevent the disease based on individual predisposition. Okay, so the genetics, and analyze it in such a way with AI that will help you, or preventive steps for a certain predisposition. You and I or somebody else may be a pre-diabetic, many things that you can be that you may not know, but these complexities, so simplest to the complex, but both leads to much better healthy lifestyle, much better health outcome, much better health operations and treatment plans, and much better overall mental, physical, and spiritual health of humanity at large. I think this is where AI is leading, and fast is not even the right word anymore. Fast is too slow. The way it's extending and the way it's progressing, fast itself is we have to find another word than fast to explain the exponential. Those two words has to be replaced with something else. Fast and exponential is too slow for AI progression.
Right, right, right. So, another few follow-up questions to that. So, now with this evolving landscape, how do you see you're a healthcare leader running a global business? How do you see executives and leadership roles evolving as well with this technology? Because not everybody has been, I mean, obviously in conferences, all I am hearing till last year was that, you know, is AI safe? Is it secure? Should we be using it? Now it's like, hey, when do we start? So there's a mind shift change definitely within the last year and this year. But how do you see leadership roles evolving and executive roles in health systems evolving with this new wave of AI?
First of all, anything you do new, there's always first the ridicule, doubts. People laugh at you, people against it. That's normal for any technology or anything you're trying to do that is outside of a norm of that particular time and space. Okay.
Mhm.
So AI is no different than anything else. So yes, a year ago or two ago, yes, I was also skeptical. I'm like, oh my God, AI and how are we going to take care of all these people? It's going to get rid of all these people, and then we are going to lose all these jobs. I was of that opinion as well. In 2 years, I'm on the opposite side, because a couple of things as a leader, you need to embrace the change. That's very important, especially where you're in a leading position, not in your company, but on the world stage, like I am. You cannot not afford to walk away or look away. You have to analyze it. You have to see the possibilities, and you have to be able to execute it. And you have to take that decision. People at my position have to. It's not anymore whether I will or not. It is now at the point where how soon and how fast are you going to do it? Because if you're not, definitely, you'll be left behind. Other businesses who are smaller, more nimble will take over very fast. Doesn't matter how big, how old the business are. If you remember in 2000, early days of internet, AOL is buying the Warner Brothers or something, the 100-year-old companies. We were showing those comparisons, or other 80-year-old companies, these small internet companies. Same thing, we're back into the same phase where these AIs will buy or take over businesses there. Who knows how old, doesn't matter, or it will basically wipe out your entire business if you don't follow, understand it, and execute it and bring it into your business. There is no option anymore, whether we like it or not. It's just part of our lives, and we have to take it with, of course, uh, precautious and careful analysis of the particular business that you are in, and how you're going to use that at your advantage against the competition, if there is any.
Right. That's great advice for all the leaders listening to this podcast. Thank you so much for sharing that. Moving on to our last question. If you had to invest in one area of healthcare innovation today, what would it be and why?
For us, which we've been talking to you and your partner, is to create the avatars because I don't want to be talking. I have so much experience in this particular industry, being a pioneer in building this entire modern field of stem cell science from scratch, not just our company, this entire field. Anybody and everybody around the world working in the field of stem cell research or stem cell treatment, they're working based on original pioneering research work that we've been doing for the last 2 decades and more. And that much of knowledge, experience, and wisdom, I cannot keep repeating myself, right? That's why we talked with your team to create the avatars of our team members such and take all our past knowledges and publications and interviews and everything and train the avatars such so that you can interview my avatar today on
I
your
was about to
podcast,
say.
and hopefully that avatar will speak exactly the way I would have spoken in my experience of last 20 plus years in this industry. That I wouldn't call it a long way to go, but I think we're almost there to fine tune it. You
Right,
tell me,
right.
what do you think?
I was about to say the next thing I know, the next time I reach out to you to interview you, you've sent your AI avatar.
There you go. There you go.
Yeah. So definitely, I mean, in terms of healthcare innovation, I feel AI is helping in a lot of clinical support, decision support, creating reports, creating different kind of documentation, time-consuming documentation, and most of all, like the two areas which I see is providing care where care isn't being reached. So in between consultations to people who are not able to get to providers and things like that. So that is, and population health, definitely. So those are a few of the areas where I see it growing. So that would be the end of the session. Thank you, Deven, so much for taking out the time to speak with us. And yeah, look forward to having many more great sessions like this.
Thank you, thank you for asking the wonderful questions that you've been asked, because that's what allow the guests to give their best when you have the best host to ask the most important questions. So you've done a great job of doing that.
Thank you so much. That's awfully sweet.
Thank you.
All right.
Yeah.
Have a
So
great day.
we'll meet soon.
Yes, yes, absolutely.
Thank you.